ambulance started off in the North East as a pilot in 2009, and North East Ambulance Service did such a good job that we were then able to roll it out across the region in April 2013. We cover 3,200 miles and a population of 2.7 million people. It's for patients who have urgent need of advice or care, but it's not an emergency or life-threatening. It gives them so many more options in terms of support, and it's all about getting the right care for the patient.
This is NHS111, Vicky speaking. How can I help you today?
He's been a bit unwell over the weekend, and this morning he was crying because of pain in his ears.
Isaac suffers from febrile convulsions. His tonsils were removed, so I didn't particularly expect him to have another convulsion, but as it was late at night, there was nobody else I really could ring. So I rang 111. They wanted to make sure that there was no major issues and nothing that should be getting flagged or that required any further assistance first. There's a massive peace of mind when there's somebody at the end of the phone that's just saying, yes, you can do this, it's all right, you can give him the extra, you can put him to bed, he will be fine. If there are any issues following that, you've got somebody at the end of the phone that you can give a phone call to, and, you know, helps you sleep a bit more soundly.
So when a patient calls NHS111 service, we take their demographic information, we'll match them to their medical records by use of their NHS number. We'll then take them through a clinical triage, asking them questions based on the symptoms that they're presenting with. And then from there, we'll determine the best level of care for the patient based on their symptoms and then refer them onto that care. So whether that be booking them a patient appointment, telling them go to their own GP, advising them to attend a pharmacist or attend an emergency treatment centre, or alternatively send them out an emergency ambulance response.
What's your name, please?
Kirkham, John. I used the 111 service about 2 months ago because I was coughing up blood. When I phoned the 111, the lady, very nice lady, asked us what was wrong with it, what I was concerned about, and I told her I was coughing blood up, and she turned around and says, right John, she says, I advise you within the next hour to go to the RBI. The lady that spoke to us was very good, very, very good. And I was over the moon. I was over the moon with her.
I haven't felt too well for a couple of days. I'll go through a telephone assessment now and we'll see what the best level of care for you is today.
I do suffer quite a lot with water infections, and they're normally a couple of times a month. And then if you can't get a GP appointment, which is really unlikely on the same day, then I have to go to the emergency unit. So I rang the 111, then they got me an appointment. It's taken the pressure off 999 when it's not an emergency. It's taken the pressure off the GPs and the pressure off yourself having to wait for an appointment. And it's nice to have the reassurance that that is there, and I think it's a brilliant service.
It started off as quite a minor thing. There was soreness in my toe and I'd hurt it. It became very inflamed and very uncomfortable, and then very uncomfortable. I rang the GP practice and they had an answer phone which directed me to 111. They're calm, they're methodical. They explained what they were doing and why, and I was happy with that. I think to know that you can pick up a phone and quickly get somebody who cares, has got a system to help you, especially if you live alone, it's just excellent. I would recommend it every time.
Well, Thomas was a pre-diabetic, and he's been really unwell for quite a few days with cold and cough. He didn't want to eat anything for breakfast, so his medicine that he has to have in the morning has to be with eating with food. So I phoned 111 for some advice. It was a matter of a couple of minutes. They answered the phone. I got what the information that I needed at a busy time of the day. I don't like to use Google or any of the other websites. I like to get it from a professional or medical person. So if I know that they've got the advice there on the phone for me, then it means I don't have to bother my doctors. Trying to get an appointment is quite challenging for the times that I need. So it's always been there. Very good. It's done us proud. Mm-hmm. Yeah.
Patients should call NHS111 whenever they have a medical problem that they require support or assistance with that isn't an emergency. And it's really difficult to decide when an emergency is an emergency, so pretty much any time that the patient is unwell and they feel they need support, they can ring NHS111, because within the North East Ambulance Service system it doesn't matter, because if they do require an emergency ambulance, they'll be transferred onto that service immediately anyway.